Hi, I'm Judith Heller, and I'm proud to oversee physician recruitment at the Northwell Health System. I'm pleased to partner with our clinical leaders. Now I'd like to share with you their vision for growth.
Welcome to South Shore University Hospital. I'm Donna Morovic, the Executive Director of this hospital. I'm hoping you are considering to join our family, because that's what we are, a family.
About 24 years ago, Southside joined Northwell Health, and over that span of time, we've made tremendous investments in this facility.
This institution transformed this community as well as this region. South Shore University Hospital has delivered care here that they have never, ever had. It's unbelievable quality care to people in this community who couldn't have received that care.
And that's brought a level of clinical excellence in many very complicated fields of medicine to a community that didn't really have that level of care in the past.
We have the ability to now do every kind of procedure in this hospital that was not able to be done 10 or 15 years ago. And the patients from Riverhead, from Montauk, don't have to travel to the city to get the care that they need. They're able to get that care here in this hospital.
We are in an incredible growth phase here. We are building and building and building where others are cutting. It's just amazing the investment that Northwell Health has made in our facility and in our communities. And I think the community knows that, they see that. And so for those of us that are Northwell Health doctors, we're particularly proud to be a small part of that. We have access to everything that New York City has to offer, but without the expense and without the aggravations of a big metropolitan city.
I love the integration that Northwell has with the community, that Northwell is involved in the community and has touched lives throughout the Long Island, New York region.
Even year to date, we have over 660 transfers in. When I was here 8 years ago, when I started, we transferred everyone out.
We recently attended a ceremony for the unveiling of our new parking garage. It's probably the highest structure in Islip Town, and therefore it was very important that we made it something that was pleasing for everybody to look at, and at the same time very functional to help the staff here. At that same unveiling, we also unveiled that we renamed the hospital from Southside Hospital to South Shore University Hospital. It was important to announce this because we really are a different hospital in so many respects in terms of our ability to provide tertiary quality care, and the new name change reflects that ability.
We've enjoyed the ability to bring in cutting-edge technology across a wide variety of departments.
What I have behind me is the Da Vinci robot. I brought it with me just to highlight the fact that when I got here, there was one service using it and we had one robot. Since I've come here, we've added general robotics, advanced laparoscopic, hernia surgery, as well as bariatrics and foregut. We will be an epicenter for thoracic robotics, and the plan once they open the Women and Babies Pavilion is to get a third robot.
In our cancer center, we have a brand new radiation center, brand new PET scanners. We really have the best equipment on Long Island, and we're particularly proud that we have those resources to make taking care of our patients that much easier.
This is an example of one of our new patient rooms. It is thoroughly up to date and modern, but importantly, it is a calm and comfortable place through which healing care can be delivered. We currently have a surgical critical care unit and a medical critical care unit, as well as an advanced cardiothoracic critical care unit. The best is in many ways yet to come. We will be enjoying a new pavilion soon, which will be giving us enhanced patient rooms as well as increased procedural capacity.
We're really excited to announce to our communities that we're building a women's and infants pavilion at our hospital intended to take care of patients that are pregnant and expecting, their newborn babies, and women that need to have gynecological surgeries.
Right now, we're standing inside phase 1 of the new Women's and Infants Expansion Project.
Within this project, we have 2 additional ORs, 2 additional C-section rooms, 2 laboring suites, 16 neonatal ICU beds, and on the 2nd floor we'll have 29 postpartum beds. This is 2 bracket. This is our surgical unit. Coming this fall, we will begin our bracket expansion project, which will be a 4-story expansion on the 3rd floor, on the 4th floor, and on the 2nd floor. On the 3rd floor, we will be adding 2 hybrid ORs. On the 2nd floor, which is 2 bracket, we'll be adding 6 additional beds. And on the 4th floor, which is a step-down unit, will be an additional 6 beds as well.
This hospital has the ability to do very high-level procedures, and those are only truly possible because of the expertise and also because of the equipment that we have available to us.
Here at Bayshore, you can come in a timely fashion, and we can take you straight into the biplane suite and try to help you if the patient has a stroke. Also, patients with any vascular abnormality in the brain, right, that they have a bleed. This technology will allow us to study their blood vessels and have a look at them and then come up with a treatment that will help them prevent another bleed and recover from the recent bleeding.
We're in one of the electrophysiology labs of South Shore University Hospital. In this room, there is a mapping equipment. We have multiple imaging modalities. We have the ability to do CAT scan on the table and merge that with the imaging equipment that we have available for electrophysiology. In addition, this room is big enough to allow for other equipment to be brought in. For example, the TEE equipment, the anesthesia machines. So that space is extremely helpful for us to actually provide the appropriate care for this patient. We are able to really perform any and all procedures that can be imagined in the cardiovascular, electrophysiology, or into the neurointerventional field.
From the get-go, we knew that we wanted to do all comers, all patients, regardless of the risk that they might have. In the last almost 10 years, we have achieved the goal with the state-of-the-art cardiac surgical techniques and other state-of-the-art technologies that we utilize. Recently this year, we were noted to be one of the lowest mortality cardiac surgery programs in the state of New York.
We have a great inpatient team, which includes, from a cardiac perspective, interventionalists, general cardiologists, electrophysiologists, and those patients are managed in the hospital, and then they're managed in our practice outside of the hospital, which is only 2 to 3 blocks away.
One of the great successes of our program has been the Follow Your Heart program. This is a phenomenal program where when patients are discharged and go home, we have a clinical person that sees them in the house and makes sure that they're taking their medication, their wound is healing well, and that everything is going well. And it's been great for the patients because they feel like they're still being cared by the team that took care of them in the hospital.
This hospital is the trauma center for the entire region. We are the hospital that will take any traumatically injured person, whether it's by ambulance or by helicopter, and provide them with the state-of-the-art care that they need that they can't get at a community hospital.
When we were expanding our campus, we expanded our emergency room, we added the only FAA-sanctioned helipad in Southern New York on the ground. It's an exciting thing to see because it was affirmation that we are doing the right thing for this community.
This is a 55,000 square foot trauma center that just finished construction 2 years ago. So it is state of the art. Everyone who's working in the facility is board certified, and we have a huge network of physician's assistants that also are board certified. I think the other advantage is that we just started an emergency medicine residency program, and what that also lends to is continued expertise.
The internal medicine department at South Shore University Hospital has grown tremendously. We now have subspecialists in every major field, people who are top-notch, academically trained, interested in teaching and clinical research, and most of all, do a tremendous job in both the inpatient and outpatient care of our patients. So I've been practicing gastroenterology now for 41 years. We do more and more what we call advanced endoscopy. In addition, we're working in the future to actually do surgery endoscopically. So now we are able to do newer procedures that have less risk, have less morbidity for patients, and are kind of exciting to be able to do, to offer to patients.
I was recruited from North Shore University Hospital to build a neuroscience program. And what we have accomplished is really phenomenal. We have augmented the service line here, and we've actually created a tertiary neuroscience center. We now have a department here that could handle anything in neurosurgery.
South Shore University Hospital, it's been an exciting time for us the past 10 years or so. We got certified by Joint Commission for adult reconstruction or joint replacement. We've got a new focus on education. These are all things that I was interested as a surgeon being part of.
Sadia and I run the hospitalist department. It's a large group here. We have about 40 full-time staff. We take care of probably 80% of the census here in the hospital.
We are a big melting pot. It's full of diversity. It's full of energy. Regardless of any challenge that's thrown at our group, we continue to work together, partner together.
There's a wonderful collaboration that occurs here. That's something that most places don't have, and we're probably one of the few places left that gives you that university ability to take care of patients, but also gives you the community feel.
Because a lot of what sets South Shore University, aside from the other system hospitals, is that we're one really big family.
One of the most exciting things about South Shore University Hospital is the education that is growing in this building. The residents become part of the fabric of the institution. We need to be at the top of our game because they're at the top of theirs. They challenge us freely, and the good part about this institution is that we're not afraid to learn. People who come here to learn have direct access to transparency and to the talent that's necessary at the bedside. It's never more than a phone call away to get everybody at the bedside, and that's why some of the most amazing stories of success have emanated from South Shore University Hospital.
We have fellowship programs that we've started and new ones that we're developing. And what's been really satisfying for us is that we've been very competitive in getting the very, very best trainees to come and train here. From Ivy League institutions and some of the best medical schools, our residents have come from all over the country to train with us, and we're really, really proud of that accomplishment.
When you're part of Northwell Health, you're part of one of the largest health systems in the country. When you add to that our own Feinstein Institute, one of the finest research institutes in the country, and add to that our affiliations with places like Cold Spring Harbor, the magnitude of things we can learn through research from this patient base is amazing.
Every morning at 10:30 a.m. we have a bed huddle. It is multidisciplinary. It is the lab, it is pharmacy, it is physicians, it's our hospitalists, it's our physician leadership, it's our nursing leadership. We all hear about the past 24 hours and the next 24 hours. What do we think is going to happen? This huddle is transparency, especially post-COVID. During COVID, we did it virtual by phone.
Physicians understand that we need to come together. Not every one person may have the answer, but we definitely have the people here and the capability and the minds to put them together and discuss patient care and come up with the best solution for the patients.
Everybody has an input. Everyone's important. It's one big team.
When the patient comes in the door, they feel like they're in the right place. They feel like they're in the right hands.
Being part of Northwell is greater than just being at South Shore University Hospital. You get so much support from all the additional departments and ancillary services that it really puts your practice together for you. And it allows you to take care of the patients the way you want to. It's nice just to come here to work with your nurses, your physical therapists, your physician extenders, and realize that they're all committed to the growth of this institution. I think most of us recognize that this institution will take care of us someday. So we want to push it to be better.
Because of the scale of the health system, your ability to make connections across the different hospitals and across the different practices, and your ability to take advantage of all the educational opportunities and professional growth opportunities are tremendous.
It's important to really weigh, when you're making these decisions, what actually gives you happiness. We're building programs here. If that excites you to be a part of growth, centers of excellence, being a part of a team where your opinion actually matters and your perspective is an important part of how we grow and develop, then this is the right venue for you.
We have just opportunities that are endless. I started out as an ICU nurse, and I am now the CEO of this hospital. I see that for anybody here who is willing to learn, willing to grow, and willing to be a part of a larger entity. So the real question is, are you made for this?